Welcome to part 2 of Module 5, Session 3, which is music therapy experiences with students with additional needs. And so we're going to continue our exploration of this area that we began in part 1. In part 1, we mentioned a lot about multi-sensory approaches. So we're going to dive a little bit deeper now into what multi-sensory approaches we can maintain and introduce. So there, including visual senses, can we use pictures, diagrams, or mind maps? Can we use color coding or demonstrations? If we're thinking about oral approaches, can we integrate explanations, repetition, recordings, and discussions, and use word association, so putting words to music or associating words with key signatures and rhythms? And kinesthetic, so can we use movement to music by adding actions? Can we use art or writing to consolidate our learning? And can we do hands-on learning where possible? So examples might be playing or singing themes from a set piece, using shapes to represent different intervals, or walking and running to consolidate a tempo. So we have a fabulous article here all about the importance of using multisensory and integrating multisensory approaches for our neurodivergent learners and clients and students. So I highly recommend reading this from Science Direct. So take your time if you want to pause, if you'd like to pause the video now and engage in some reading. So thinking about some fantastic multisensory approaches to learning that have been developed, some fantastic systems, we think about Suzuki. So Suzuki being one method. So, and this is why Suzuki method could be really beneficial for our neurodivergent learners. So Suzuki teaching method includes parental involvement. So parents are encouraged to give extra support and time. Suzuki method, it begins by listening. So Suzuki said that as a child acquires his or her mother tongue by being exposed to it, he or she can also learn music by being surrounded by music. And that is a beautiful way of, again, correlating our language and our music skills. The Suzuki method involves learning by listening or ear first, thereby encouraging and developing listening skills first, which the student can then relate to the notation. The Suzuki method also includes observation, so observing other students playing and continuing to learn by visual and auditory example. It includes demonstration, so demonstration and learning is structured in a step-by-step approach, consolidating and building on acquired knowledge. Again, we have this step-by-step mastery, so as mentioned previously, and also supporting confidence and self-esteem through achieving step-by-step goals, consolidating on what we've already learned. Memory, learning without following notes initially, then correlating music to the notes. Common core repertoire, so the repertoire continues to build on skills already learned, compounding the step-by-step approach. And review, so the pieces that are played are not left behind, allowing students to revise and regenerate skills, keeping the skills that they've learned with them. And group work, so it helps improve social skills at the same time as the musical ones. We also have Dalcroix's teaching method. So the Dalcroix method in which students initially listen to a piece of music, then express what they hear through movement. And this connects music, movement, mind, and body. And Dalcroix or eurythmics is another term for Dalcroix method. Eurythmics means movement and describes developing musical skills through kinetic exercises. Students absorb the rhythm and structure by listening to music and expressing what they hear through improvised movement. And Dalcroix also uses solfège to develop ear training and sight singing skills and improvisation using instruments, movement, and voice. Now we're going to move on to ADHD and have a little deeper consideration around ADHD. What is ADHD and how can music support our ADHD learners? So ADHD is one of the most common neurodevelopmental disorders of childhood, and it is usually first diagnosed in childhood and often lasts into adulthood. So we have a video that we recommend here. What is ADHD to help us explain and explore what it is a little bit more in depth. So children with ADHD may have trouble paying attention, controlling impulsive behaviors. So they may act without thinking about what the result would be or be overly active. Again, we have another little video for better understanding. It said 2 minutes on neuroscience of ADHD, and we encourage you to watch it now. And we also recommend these 2 pages of general information. One of them is ADHD Ireland, so our own national ADHD organization here. I also encourage you to seek out your own national organizations and find out what information might be available to you from your national sources. So ADHD, or attention deficit hyperactivity disorder, is a medical or neurobiological condition in which the brain's neurotransmitter chemicals, noradrenaline and dopamine, do not work properly. So ADHD and ADD is usually described as being made up of 3 core behaviors. The predominantly inattentive type, so problems of attention, distractibility, short-term memory, and learning. The predominantly hyperactive type, which is impulsive, poorly self-monitored behavior. And the combined type, most children with ADHD, ADD fall into this category. So what is the music and ADHD connection? So aspects of music making that may support the development of children with ADHD include timing. So music making can support our temporal structure, as we looked at earlier in our exploration of music and dyslexia. And this can support children with ADHD in the areas of temporal processing, such as being on time and their sense of duration. As we saw in the previous video, low levels of dopamine may be one of the neurochemical factors in the occurrence of ADHD. And with relation to music and our mental health, creating and listening to music can increase our dopamine levels. And this could contribute to a decrease in some ADHD symptoms. So as we noted, music can be related to our mental health, and we can consider music engagement in relation to the emotional impact of ADHD. So I'm going to draw your attention to an article in Psych Central magazine, and William Schroeder states that music enhances parts of the brain that are weak in ADHD children. The auditory, visual, spatial, and motor cortices of the brain are all strengthened by music. Speech and language abilities, reading comprehension, math, problem solving, brain organization, focus, and attention issues are all linked to these domains. Now I'm going to bring you to an Lancet study from 2017 on ADHD. So this particular, and we can see a link to this article within the PowerPoint. So this particular Lancet study measured differences in the brain structure of 1,713 people with a diagnosis of ADHD and 1,529 people without, all aged between 4 and 63 years old. And this is the largest study to date related to ADHD neurology. And the study found that overall brain volume and 5 of the regional volumes were smaller in people with ADHD. The caudate nucleus, putamen, nucleus accumbens, amygdala, and hippocampus. So these were the areas of the brain that were primarily affected by ADHD. Besides the caudate nucleus and putamen, for which previous studies have already shown links to ADHD, researchers were able to conclusively link the amygdala, nucleus accumbens, and hippocampus to ADHD. The researchers hypothesized that the amygdala is associated with ADHD through its role in regulating emotion, and the nucleus accumbens may be associated with the motivation and emotional problems in ADHD via its role in reward processing. So the hippocampus's role in the disorder might act through its involvement in motivation and emotion. At the time of their MRI scan, 455 people with ADHD were receiving psychostimulant medication. And looking back further, 637 had had the medication in their lifetime. The different volumes of the 5 brain regions involved in ADHD were present, whether or not people had taken medication, suggesting the differences in brain volumes are not a result of psychostimulants. We've learned that music has a significant impact on the development and activity of both the hippocampus and amygdala regions in aspects of emotional response to music and long and short-term memories. So that is definitely, and we have some more interesting articles for you to read here. One is Science Daily and one is in Frontiers. And yes, please do take some time to read these articles. If you'd like to pause the video and read them now, you are most welcome. So some conclusions that we can reach with the links between ADHD and music. So more research studies are definitely needed in this area. So music can also impact the chemistry of the brain, i.e. the production of dopamine, which may also be a significant factor in ADHD symptoms. And that's really important when we think about our mental health. And we will be looking at that in a further session down the line as well. Really, really important to know that music increases our dopamine levels. When we look at the areas of the brain which affect the symptoms of ADHD, research tells us that music can significantly activate and support the development of these areas, for example, the amygdala and the hippocampus. Temporal processing is structurally integral within music, and again, timing is central to the symptoms of ADHD. Again, a recap on some practical suggestions for our students with ADHD. So let's set a seat for the student, preferably at the front, where they won't be easily distracted, where they can easily engage and focus to the best of their potential. So let's keep the classroom uncluttered, especially around the board. Allow the student to fiddle with blue tack or rubber bands or squeeze ball, etc., or another chosen object during teacher talk. So allow them to use those sensory stimulants so that they can better focus and engage. Give instructions simply and clearly, and try to have eye contact with the student when speaking to them or giving instructions. Again, use those prompts that encourage them to tune in. Use the student's name if asking them a question or giving an instruction. Ask the student to recall information or repeat instructions to assess their understanding. And use higher and lower order questions and discussions to avoid having the student drift off. So some easily accessible questions mixed in with some higher order questions so that students can come in and be hooked with perhaps the lower order questions and then maintain their focus and attention. So we're going to use a visual timer for specified tasks in the classroom, which would really help to understand the, again, our link between timing, the finite nature of the task that we are doing. To plan a setting time at the start of class at 2 minutes and ask for this time to be silent while students get ready for the class. So really to set the tone and the engagement for the class. Give clear guidelines presented as though you assumed it would be completed and not a request. So I expect you to, which really lays down what the expectations are really clearly. Give regular updates on time remaining, especially in assessments to ensure good pace. A visual digital clock is good here. And structure a movement break within the class to allow the student to move, leave, walk, etc. Try to have multiple forms of teaching within the class, so auditory, visual, and kinesthetic. Again, our multisensory approaches, theory and practical. And when scheduling classes, try to provide shorter periods more times, for example, 2 30-minute classes rather than 1 by 1 hour class in a week. So shorter times in which we can be really focused and engaged, and after which we can take a break. So we have a lovely, what is termed as a success story, I think is part of the subtitle of this video. It's a YouTube link. It's called Failing at Normal. And it's a wonderful woman who really encapsulates her experience of living with ADHD. Now we're going to have a quick look at dyspraxia or DCD. So developmental coordination disorder, commonly known as dyspraxia, is a complex neurological condition affecting fine and/or gross motor skills, motor planning, and coordination in children and adults. It is not related to intelligence, but can sometimes affect our cognitive skills. Early identification and intervention of children with or at risk of DCD is important to help prevent the potential negative developmental trajectories and psychosocial consequences associated with DCD. And that's from Zwicker et al. 2021. So let's watch these 2 videos here to deepen our understanding of what dyspraxia is. So dyspraxia and music, we found this wonderful woman, Stephanie Guidera, who is a professional classical singer who was diagnosed with DCD at age 20. She's the patron of the Dyspraxia Foundation, and Stephanie has said dyspraxia is like the physical version of dyslexia. This was on BBC Radio 5 Live in 2017. Her insight and suggested strategies, which are based on her personal experience, might be beneficial to other musicians with DCD or dyspraxia. And they're taken from an interview with the chair of the British Dyslexia Association Music Committee in 2017. And there's a link to a related BBC article below, so we can find it here in the article below. So here's some of the kernels of what Stephanie has suggested. Stephanie suggested that there are some specific strengths and difficulties for musicians with DCD or dyspraxia. A musician may be of an extremely high standard on voice or instrument and may, for example, have an extremely good ear, but may not be able to see these aspects as strengths. It can take time and support from others for this realization to take place. That's so important, to have a strength-based focus, to really perceive all the things that you are so good at and all your strengths first and foremost. And musicians with DCD and dyspraxia may be able to easily see patterns in music, and this can be really helpful. Some challenges for musicians with dyspraxia might include difficulty seeing ahead in music, like when going into the next bar, for example, or particularly from one line to another. Mistakes when learning music can lead to further lack of confidence and giving up, and anxiety before meeting new people or in other potentially stressful situations. Stephanie explains it can be useful to have an exercise regime as a coping strategy in such situations, and preparation can include doing voice exercises and other calming routines and exercises. So for musicians with dyspraxia, there are particular challenges with organization. So getting to rehearsals, getting to lessons at the right time, on the right day, and with the right music or equipment. Stephanie remembered performing a whole choral part by memory as she'd forgotten her music. For performers on tour, remembering to bring the right clothes. A classical musician in particular might have a lot of music to organize and knowing how to practice. So it can be so difficult to work out what to do and when to do it that individuals might blame themselves and believe they are lazy. It's also possible when practicing to go into a state of paralysis, partly because of a fear of getting things wrong. It's important to approach a new piece of music logically and get used to a routine. For example, always looking at the time signature first. It can be useful to be aware of the other lines of music from one's own part, the accompaniment, etc. And the way in which music is written can help or hinder. If a score is very busy, this can create difficulties. The ways in which rhythm is grouped can be off-putting. It's possible to photocopy a score and rewrite certain sections, as we looked at in our modified stave notation. Because of difficulties in relation to the individual's surroundings and possible problems with balance, a static environment works best. So core stability is important. It may be that an individual works better when sitting down. A stable hard-back chair may be the best option. So Stephanie also suggests it's really important to find a music teacher or mentor who understands or are prepared to understand the difficulties and idiosyncrasies of a musician with DCD, and to be met with positive approaches and support. Multisensory approaches are ideal. So for example, when learning a new piece of music, record oneself, perhaps with comments. Remember to be piano here. Say these points out loud for extra aural and kinesthetic input. Record key points and moments in music lessons and listen to these. Video key bits of the lesson on a phone and look at these perhaps a number of times. And when listening to examples of music, follow the score with the finger. That's again kinesthetic practice. And take photos on your mobile phone of the music. So photocopy a score for rehearsal and put cues and other reminders onto the score. Use marker pens and color and highlight key points in chosen colors. So don't be afraid to mark your score. When performing, the music can be inside a black folder, so don't be scared that it can be seen. And it won't be obvious that it isn't the same as other people's. This is all Stephanie's suggestions. Stephanie suggests perhaps put pages of music inside plastic pockets and add sticky notes on top of these. And when learning the piano, for example, perhaps play the finger or hand shapes in the air. And this also removes pressure related to sounding right or wrong. So practicing the hand shapes before applying them onto the piano. And repetition is important. And this is my own suggestion that the skills of a music therapist here might be integral to increasing confidence and navigating practice anxiety if this is relative. And color can help some individuals process information. And one strategy could be to learn the music and to perform by ear if reading music is a real obstacle. Finally, Stephanie recommends being kind and patient with ourselves and to allow ourselves to recognize the qualities in your music making and not just the perceived imperfections. Thinking about your strengths and skills and your uniqueness of your own musical gifts. So we're gonna watch a little video now, Special Education Resources, How to Use Music to Help a Child Develop Motor Skills, and this is from music therapist Ryan Judd. We're going to focus now on our motor skills. So I'm going to highlight a study. Music supported training is more efficient than training without music. So in the above study examining music supported training for recovery of fine motor skills in stroke patients, fine as well as gross motor skills were trained by using either a MIDI piano or an electric drum pads programmed to emit piano tones. So that was the instrumentation used. And motor functions were assessed by an extensive test battery. MST yielded significant improvement in fine as well as gross motor skills with respect to speed, precision, and smoothness of movements. These improvements were greater than after CIT or conventional physiotherapy. So with equal treatment intensity, music-supported therapy leads to more pronounced improvements of motor functions after stroke than CIT. So what we see is the benefits of the added music-supported training. And music therapy has been found to offer motivation towards movement. And Clark and Tamplin in 2016 wrote that often referrals for music therapy are made because patients lack motivation for therapy and have low mood. Our colleagues assume that music will be motivating, improve mood, and offer creative ways to achieve rehabilitation goals. They are right. From a clinical perspective, we frequently see our patients experiencing these benefits from music therapy, and that was in Voices in 2016. Music therapy has also been shown to develop and maintain joint and muscle function, increase fine and gross motor coordination and control, increase muscle strength, and increase range of motion. Now, just a word here about assistive technology and AI. So these are some of the great technologies that we have available today to support us. LiveScribe Smart Pen Echo 2, which records lectures and uses Smart Notebook to take short notes, which allows students to focus on what's being said rather than write it down. Grammarly Office 365 Editor, an immersive reader, Copilot, OCR, which is handwritten text created into digital content by AI, text-to-speech aids, such as Natural Reader, speech-to-text aids, such as Office Dictate, Google Drive Typing, and Nuance Dragon, Census Access, so converts files of text to MP3, and Ontology Ally, downloading files in alternative formats. Thank you so much. Here are some of our references for this part of our session number 3. We invite you to watch and enjoy them all. And we thank you so much for joining us again. And we look forward to seeing you in session 4.